career firefighter walks into a mental health clinic complaining of memory lapses, crushing fatigue, and a hair-trigger temper he cannot control. His physician reviews 2 decades of trauma calls, diagnoses post-traumatic stress disorder, and prescribes therapy. 6 months later, the symptoms are worse. The answer will not come from his mind. It is hiding in his home. Carbon monoxide is called the silent killer because it has no color, no smell, and no taste. When it displaces oxygen in the blood, the brain begins to starve. The symptoms mimic dozens of other conditions, and in a low-level chronic exposure, they build so slowly that patients and clinicians alike can miss the pattern entirely. This is the story of how one firefighter's worsening health was attributed to the psychological weight of his job, when the real culprit was leaking into his bedroom every night. The patient was a firefighter in his early 40s, with no prior psychiatric history. He had spent 23 years responding to structure fires, vehicle accidents, and medical emergencies. His work was physically demanding and emotionally intense, but he had always managed the stress without clinical intervention. Then, over the course of several months, he began to notice changes. He felt persistently tired, even after a full night of sleep. His concentration faltered during routine tasks. He became irritable with his family, snapping over small frustrations that once would not have registered. His wife noticed the shift first and urged him to see a doctor. At his initial evaluation, the firefighter described the fatigue, the memory problems, and the anger. He mentioned occasional headaches and a vague sense of dizziness that came and went without an obvious trigger. His physician asked about his work history, and the firefighter recounted years of exposure to traumatic scenes. The physician, trained to recognize the psychological toll of first responder work, diagnosed PTSD and referred him to a therapist specializing in trauma. The firefighter attended sessions regularly and tried the recommended coping strategies, but the symptoms did not improve. The headaches grew more frequent. The fatigue deepened. His wife began to worry that something more fundamental was wrong. 6 months into treatment, the firefighter returned to his physician and described the lack of progress. He was referred to a neurologist to rule out a structural problem in the brain. An MRI showed no tumors, no strokes, and no signs of degenerative disease. Blood tests came back within normal ranges for thyroid function, vitamin deficiencies, and inflammatory markers. The neurologist documented the findings and suggested the symptoms might still be related to stress, perhaps with an underlying sleep disorder contributing to the fatigue. A sleep study was scheduled, but before it could be completed, the firefighter collapsed at home. His wife found him unconscious in the living room one evening and called for an ambulance. Paramedics arrived within minutes and measured his oxygen saturation, which was lower than expected. In the emergency department, a physician ordered a carboxyhemoglobin level, a blood test that measures the percentage of hemoglobin, the oxygen-carrying protein in red blood cells, that is bound to carbon monoxide instead of oxygen. The result was elevated, not acutely life-threatening, but high enough to indicate ongoing exposure. The emergency physician asked about potential sources, and the firefighter's wife mentioned that their home heating system was old and had not been serviced in years. A building inspector was called to the home the next day. Using a carbon monoxide detector, the inspector found elevated levels near the furnace and in the bedroom directly above it. The furnace had a cracked heat exchanger, a component that separates combustion gases from the air circulated through the home. When a heat exchanger cracks, carbon monoxide can leak into living spaces, and because the gas is invisible and odorless, occupants have no warning. In this case, The leak had been slow and intermittent, worsening during the winter months when the furnace ran most often. The firefighter had been sleeping in the affected bedroom for more than a year. Carbon monoxide binds to hemoglobin with an affinity more than 200 times greater than oxygen. When the gas is inhaled, it occupies the oxygen-binding sites on red blood cells and prevents oxygen from reaching tissues throughout the body. The brain, which uses roughly 20% of the body's oxygen supply, is particularly vulnerable. In a chronic low-level exposure, the symptoms develop gradually and can include headache, fatigue, difficulty concentrating, irritability, dizziness, and memory problems. These are also symptoms associated with depression, anxiety, sleep disorders, and post-traumatic stress. Without a specific reason to measure carboxyhemoglobin, the diagnosis is easy to miss. The firefighter was treated with high-flow oxygen in the emergency department to displace the carbon monoxide from his hemoglobin. The half-life of carboxyhemoglobin, the time it takes for half of the bound carbon monoxide to clear, is approximately 5 hours when breathing room air. With supplemental oxygen, that time drops to about 90 minutes. The firefighter remained in the hospital overnight for observation and was discharged the following day with instructions to avoid the home until the furnace was replaced. Over the next several weeks, his symptoms began to resolve. The headache stopped, his energy returned. The irritability and memory lapses faded. The diagnosis of PTSD was reconsidered, and the firefighter did not require further psychiatric treatment. This case illustrates the diagnostic challenge of carbon monoxide poisoning when the exposure is chronic rather than acute. In high-concentration exposures, such as those from a running car in a closed garage or a malfunctioning generator indoors, the symptoms are dramatic and the diagnosis is usually clear. But in low-level chronic exposures, the symptoms are non-specific and can be mistaken for psychiatric illness, neurological disease, or simple fatigue. The firefighter's occupation added another layer of misdirection. First responders do experience high rates of PTSD, and clinicians are trained to consider that diagnosis when a firefighter or paramedic presents with mood and cognitive symptoms. In this case, that reasonable assumption delayed the correct diagnosis by months. The outcome was favorable because the exposure was discovered before permanent neurological damage occurred. Prolonged or high-level carbon monoxide exposure can cause lasting injury to the brain, including deficits in memory, attention, and executive function. Some patients develop a delayed neurological syndrome that appears days or weeks after the initial exposure, even when the acute symptoms have resolved. This firefighter avoided those complications, but his case is a reminder that environmental causes must be considered even when a psychological explanation seems plausible. Carbon monoxide detectors are inexpensive and widely available, yet many homes still lack them. Heating systems, water heaters, and any fuel-burning appliance can be a source of carbon monoxide if they malfunction or are poorly maintained. This firefighter, trained to recognize hazards in other people's homes, had not suspected that his own home was making him sick. This video is based on a publicly documented medical case and is intended for education and storytelling only. It is not medical advice. If you are experiencing concerning symptoms, consult a licensed medical professional. The firefighter in this case recovered fully after the source of his exposure was identified and removed. His symptoms, initially attributed to the psychological toll of his work, were the result of a slow, invisible poison that entered his home every time the furnace cycled on. The diagnosis was not found in his trauma history. It was found in a cracked piece of metal in his basement. Medical mysteries. Every symptom has a story. Every patient deserves to be heard. Medical disclaimer. This video is based on real, publicly documented medical case reports and is intended for educational and storytelling purposes only. It is not medical advice. If you or someone you know is experiencing similar symptoms, please consult a licensed physician immediately.